The idea of this optional masking that you can wear is hopefully going to empower people and make them feel more comfortable to the important jobs that they do every day. We're rolling it out, as you know, overnight. And we're going to be moving out to a few more groups, particularly our really front-facing groups, our security folks, people working in EVS and food and nutrition services, for instance, and our screeners, and see how that goes. And then we're going to roll it out as an option to the rest of our facilities, our clinics and our hospitals. When we think about the option to wear masks in a prolonged fashion, that is an extension and different from our usual infection prevention and control recommendations, right? We don't like to wear PPE, personal protective equipment, outside of those direct healthcare worker patient interactions. We are offering this because of this lack of really definitive knowledge around the role of asymptomatic or pre-symptomatic transmission. We also recognize that healthcare workers have a tough time staying 6 feet apart in many parts of our facilities, and so this could be potentially a mitigation for that. So it's really important to recognize that healthcare workers within UW Medicine have access to the PPE they need, and that's really the highest priority for us, because we can't take care of patients unless healthcare workers are safe and feel safe. So all patients who are being taken care of by healthcare workers are being taken care of with healthcare workers in the appropriate personal protective equipment. All of this is really dependent on a couple of things. One is, how does the supply of personal protective equipment going forward? This is all dependent on that, because we cannot ever allow healthcare workers to go into a scenario without the right PPE. At the same time, we want to do it in a way that keeps our patients safe. The most important thing, I think, in hospitals and healthcare looking around PPE is recognizing we need to be flexible and we need to be responsive in a pretty rapid way to look at what's happening on the ground, look at the data, what's happening in our emergency departments, our clinics, and our hospital floors to make really good choices to protect healthcare workers first. The most important thing we can do in the community is social distancing, the physical distancing. This is critical and needs to keep going. People may have seen the new triage tents outside of the Harborview Emergency Department, and you will be seeing outside of other emergency departments in the city going forward, is this idea of how can we spread out patients. So when we think about, if we were to see a large surge of patients with suspected or known COVID-19 infection, one of the most important things we can do above and beyond masks and everything else is actually create some distance between the patients themselves, so that we don't have people who have COVID-19 really close to someone who doesn't have COVID-19. This is going to provide basically, increase the size of our emergency department, create more spaces for patients to be seen, for patients who can walk and potentially go home with their infection. It's going to be a safe and effective way to quickly get them through our emergency department, not use up lots of personal protective equipment, keep our healthcare workers safe, and I think honestly take care of them in a really efficient way.